The central challenge in modern in vitro fertilization is an exercise in biological attrition. The goal is to generate a high yield of mature oocytes and highly motile sperm, yet clinicians constantly fight against systemic friction that degrades gamete quality. That friction takes the form of measurable physiological barriers. Advancing maternal age, subtle hormonal imbalances, and localized oxidative stress all compound to compromise the developmental competence of these cells. But the clinical data reveals an anomaly. When complementary modalities, like targeted acupuncture and herbal medicine, are integrated into standard IVF cycles, the data shows statistically significant improvements in those exact parameters. These modalities operate on quantifiable biological pathways. They do not rely on esoteric concepts. Instead, they alter targeted hemodynamics, modulate the hypothalamic pituitary-ovarian axis, and upregulate systemic antioxidant defenses. To maximize assisted reproductive technology outcomes, clinicians must actively optimize the physiological environment of the gametes alongside standard hormone stimulation. To understand how these outcomes occur, we have to deconstruct recent randomized controlled trials and meta-analyses. The goal is to trace the biological mechanisms driving these unexpected clinical results. It is important to note that these studies do not focus on optimal candidates. They isolate highly challenging clinical populations, specifically patients diagnosed with poor ovarian response and diminished ovarian reserve. In these trials, efficacy is evaluated through rigorous objective biomarkers. Researchers track anti-Mullerian hormone, follicle-stimulating hormone, luteinizing hormone, and estradiol. The most effective way to address clinical skepticism regarding complementary medicine is to analyze this raw quantitative data. By grounding the analysis in measurable metrics, we can map the precise physiological impact of integrative therapies on human reproductive capacity. This comparative chart illustrates a 2021 trial evaluating acupuncture for poor ovarian response during IVF. 16 pre-treatment sessions yielded significantly more retrieved, mature oocytes compared to IVF alone. These increases were most pronounced in women over 37 with multiple failed hyperstimulation cycles. We see similar patterns in botanical interventions. A 2022 meta-analysis aggregated data from 325 women utilizing East Asian herbal medicine for diminished ovarian reserve. The meta-analysis revealed two critical data points: consistent improvements in AMH levels and a pregnancy risk ratio of 2.13, effectively doubling the pregnancy rate compared to conventional medicine alone. The aggregated data proves a tangible increase in ovarian output. These integrated therapies successfully bypass previous developmental bottlenecks. The biological mechanism driving increased oocyte yield begins with targeted hemodynamics. Specific acupuncture protocols induce localized pelvic capillary dilation, increasing oxygen and nutrient delivery to the developing follicle. Inside the cell, this enhanced vascular perfusion improves mitochondrial function, ensuring robust ATP generation. The secondary mechanism involves neuroendocrine modulation of the hypothalamic pituitary-ovarian axis. By regulating the delicate interplay of FSH, LH, and estradiol, this modulation mitigates stress-induced physiological interference during the critical window of follicular recruitment. The statistical gains in oocyte maturity are the direct result of superior vascular perfusion and stabilized endocrine signaling. When we apply this same deconstructive framework to male factor parameters, we find parallel mechanisms addressing poor semen quality. This data board highlights a 2014 meta-analysis on acupuncture for male infertility, a 6.35 percentage point increase in rapid progressive motility, and 6.42 million more sperm per milliliter. A 2024 meta-analysis corroborated these comprehensive enhancements across semen volume, motility, and normal morphology. Again, the mechanism relies on hemodynamics. Improved testicular blood flow supports the precise balance of gonadotropins and testosterone essential for continuous spermatogenesis. Herbal interventions compound this effect. Specific botanical compounds possess targeted antioxidant and anti-inflammatory properties that actively protect sperm DNA from oxidative damage as it matures. Whether addressing female ovarian reserve or male sperm motility, the integrative protocol systematically neutralizes cellular inflammation while restoring necessary blood flow. Achieving optimal fertility outcomes requires marrying conventional ART interventions with this kind of physiological optimization. This flowchart illustrates the integrative clinical workflow. Notice how Western fertility diagnostics dictate the precise timing of the acupuncture and herbal touchpoints. Timing is crucial. Localized blood flow increases must be synchronized to match specific phases of follicular or sperm development in real time. In this clinical model, these modalities function as physiological synergists that enhance the biological efficacy of standard reproductive endocrinology. This translates the theoretical framework from clinical trial data into a live clinical reality. Evidence-informed care ensures that the theoretical benefits of hemodynamics and antioxidants are systematically executed exactly when the patient's cycle requires them. We can observe this exact protocol in practice in Manhattan. Founded in the late 1990s by licensed acupuncturist and herbalist Mike Berkley, the Berkley Center for Reproductive Wellness was the first U.S. practice dedicated exclusively to this integrative approach to infertility. With over 27 years of specialized experience, the clinic focuses entirely on collaborating directly with reproductive endocrinologists on complex IVF cases. Alongside acupuncture, the center utilizes highly individualized botanical formulations, dispensing precise combinations of dried herbs to match specific patient diagnostics. Their specific clinical focus, achieving hormonal balance, reducing oxidative stress, and enhancing organ blood flow, aligns directly with the research mechanisms we just deconstructed. As a result, their patients routinely experience higher embryo grades and improved semen analyses, often after multiple previous ART failures. The Berkley Center provides the proof of concept that rigorous, evidence-based integrative protocols alter patient outcomes in a real-world setting. The data is clear. Acupuncture and herbal medicine enhance fertility parameters through measurable, documentable physiological changes. They achieve this through targeted ovarian and testicular hemodynamics, strict HPO axis regulation, and the precise reduction of localized oxidative stress. Rather than taking a passive approach to poor gamete quality, integrative care applies proactive, targeted physiological interventions. But executing this requires true collaboration between specialized acupuncturists, herbalists, and reproductive endocrinologists. Maximizing cellular health requires optimizing the underlying biological infrastructure to ensure the body can effectively utilize exogenous hormones. To find out how evidence-informed integrative treatment can alter the outcomes of your personal fertility journey, explore the specialized care at the Berkley Center for Reproductive Wellness in New York City. Integrated fertility treatment optimizes the cellular environment upon which advanced reproductive technology depends, providing a more comprehensive physiological foundation for conception.